Thank you. Hi, everyone. Thanks for hanging around till the last minute. As I had just said with Dr. Dara, I love doing these conferences. And I'm really excited this time because usually I talk about nutrition or supplements or stress management or deep breathing techniques, anything regarding health. And this year I decided to pull something from my repertoire that I really love, and it's homeopathy. And I don't know if any of you are familiar with homeopathy. If you are, give a shout out into the chat. I'm just curious. Some people have used it and are very familiar, and other people are like, what, you're speaking French. I have no idea what you're saying. So that's what I'm going to talk about today. So just to give you an overview of what's going to happen, I'm going to welcome you guys because you are amazing. I'm going to talk about what is homeopathy? Is it effective? Is it safe? Why did I choose homeopathy to bring to first responders? How can you use it for injuries, illness, and stress? Actually, I got rid of my case examples because I was running low on time, so that's not going to happen. And then I'll have some time for some Q&A. All right, first I want to express my gratitude. My family is deep into first responders. My husband is a firefighter. He's going to retire in June after 32 years being in the fire service, and my brother-in-law is deep into the police work. And so I just am really, really grateful for all of the work that you guys do in dispatch and sheriff's office. I mean, you guys are risking your mental, physical well-being for us all the time, and I'm just really, really grateful to you. So my goal with this presentation, as is with usually all of my presentations, is to provide safe and gentle tools for you to support your health and resilience. Given that you give so much of yourself to your job, I'm hoping that this will be helpful for you to take a little bit back of your resilience. Okay. So, what is homeopathy? A very brief overview is this is a system of medicine that came out of a long time ago in Europe. The good news is that it is based in research. Now, if you are Googling what is homeopathy right now, you can see a hodgepodge of stuff, and I think it even depends on what you've searched before, what's going to pull up on homeopathy now, whether it's yay or nay. And I just love to inform both my students and my patients and people that I work with that people can cherry pick research studies that show there is no evidence that homeopathy is effective for any conditions. And that's just an absolute lie. There's plenty of research studies, which I'm going to go to in a minute, to show that it is evidence-based. And also homeopathy, one of the most important things, if you get anything out of this presentation, is that it's safe and it's gentle and it can be very effective when using the right homeopathic medicine. So like I had mentioned, this is a system of natural medicine that was put together 200 years ago, and it's basically been used in the exact same manner as it was back then. And I think that the trial standing the test of time can show the efficacy of this medicine. The medicines come from plants and minerals and animal products like bee venom and snake venom. And as I say that, I was thinking of one patient, and I had shared with him, I was thinking of two homeopathic medicines for him. I wasn't sure what to give him, and he asked me what they were. Can't remember the other. And then I was like, and then a snake venom. And he was like, give me the snake venom. He thought it was really fascinating that some of our medicines are made from products like that. There's lots of principles with homeopathy. I only want to share one in this presentation because it's important for you to understand. Homeopathy is prescribed based on your symptoms. So if I had 100 of you, I think there's 100 of you right now, let's just say you all had low back pain and you came to me for homeopathic medicine. You guys would all have a very similar presentation of pain in the lower back. But each of you would have some varying degree of how you experience that pain for yourself. For example, some of you might have low back pain that's worst when you're resting. It's worse when you're sitting down and better when you're up and moving. Other people, the more motion that they do, that will aggravate their low back pain. Some people, they get relief when they lie flat on a hard surface like the floor, bend the knees and get the pressure pushed up into the back. Other people, it's when they're bending forward. And so homeopathy takes into account all of these individual characteristics of your case of disease, and then we prescribe a medicine that's specific to you. It's not just that every 100 people are going to get the same homeopathic medicine for low back pain. You all are going to get something different. And likely there's going to be some overlap between your cases. And you would get the same homeopathic medicine. But it's really important that you understand this piece. because what often happens is people will try homeopathy, and if they choose, quote unquote, the wrong medicine, nothing happens. And again, that's part of the beauty of homeopathy. There are no side effects. If you take the wrong medicine, nothing deleterious is going to happen. However, nothing happens. So people are apt to say, well, homeopathy doesn't work. Let's just throw that right out the window. It is based on your specific case. And I'm going to teach you how to identify easily homeopathic medicines that will help you in illness and injury and with some stress. But also just know if it doesn't work for you, it probably means there's another homeopathic medicine that's indicated for your own personal case. The medicines are safe, they are non-toxic, and they are compatible with conventional medicine. And this is because they're highly diluted. Now, this can take us into the controversy around homeopathy. There's a lot of controversy around these ultra dilutions. They're highly, highly diluted, where if you or say your dog or child or somebody were to get into a vial and intake a whole vial of a homeopathic medicine, I've had patients call me freaking out about this. And I know how diluted the medicines are, is that they're not going to cause any deleterious side effects, and they're not going to work unless it's like the right specific match. So the fact that they're ultra diluted, you can use them with any medications, with patients in oncology, with radiation and chemotherapeutics. They're incredibly safe and they have no drug interactions because of this ultra dilution, which on the flip side of thing makes for a really controversial part about homeopathy. So here's a picture of them. What you will normally find in our natural food stores like Sprouts and Natural Grocers is they come in this little blue vial, and they're these little white pellets, and you just pop them under your tongue, and that's how you dose the remedy. And it's been like this for the last 200 years. We don't change a whole lot. Occasionally, you'll see some of them come in like little tablets like this. And again, they also dissolve underneath the tongue for easy absorption. Here's an example of some of the medicines I'm going to teach you about. Arnica montana comes from a flower. Most of you have probably heard of arnica in some form. Rus toxicodendron is poison oak. Nux vomica is a nut from the strychnos tree. And phosphoric acid, that's the scientific formula for phosphoric acid. These are just an example of the approximately 1,300 medicines that are used in homeopathy. So the question of is it effective? I don't want to bore you too much, but I just want to tell you that we do have a solid basis, albeit small, you'll see on the next slide, for support in homeopathy in the research. We have positive randomized controlled trials. We have positive meta-analyses. Homeopathy has been included and still is included in the national healthcare systems of all of these countries, and even more up until recently. It's been taken out of a couple of them for political reasons, but they are still included in the healthcare systems of these current countries. There's about 200 million people worldwide that use homeopathy, and according to a survey, there's about 6 million, 5 million adults and 1 million children that use homeopathy in the US. So small but growing. As of the end of 2024, we had almost 300 randomized controlled trials of homeopathic treatment that were published in peer-reviewed journals covering 158 medical conditions. And again, the gold standard placed by conventional medicine to make sure that a therapy is effective is this randomized double-blind placebo-controlled trial. And if you understand a little bit about the individualization piece of homeopathy, you might be able to understand how that's going to be really challenging to fit into this conventional model of evaluation. So I've been really impressed by the various researchers who've been able to manipulate their study design to make it fit into the randomized controlled trial. Because if we were going to do a trial on, like I said, low back pain with homeopathy, and we had 150 participants, we would probably use somewhere of like 25 different medicines or more than that. And that gets really challenging when you're using different medicines to evaluate against placebo. But anyways, so of these trials, 42% of those showed positive results where homeopathy was effective over placebo. 3% had negative results showing homeopathy was not as effective as placebo, and 55% were inconclusive. When we compare this to like conventional medicine, so on the top, the graph is showing the homeopathic breakdown of the research studies, and the bottom is showing the conventional medicine breakdown, and the references on the side if you want to look more into this. All of this information came from a great research institute that's located in London, Homeopathic Research Institute. Fantastic. The main thing that I want to point out here, it's not that there's 10% negative studies in conventional medicine and 3% in homeopathy, because that's really negligible and there's no statistical difference in that number. But it's the fact that the top graph is showing the breakdown of 172 trials, and the bottom graph is showing 1,128 systematic reviews, which contains study upon study upon study upon study in each of these reviews. So you can see the difference in the sheer number of research that has been proportioned to homeopathy versus conventional medicine. And part of that reason is that there's no patenting. You can't patent poison oak medicine, and the homeopathic medicines are so affordable and cheap that there's just no funding from companies and big pharma to do more research in homeopathy. So I think we're just sheerly lacking in our evidence when we compare it to conventional medicine, and we get roughly the same type of results from our research. The next question that I wanted to approach is it safe? So again, these are highly diluted medicines. My patients are mostly women and children, and those women become pregnant, and I treat pregnant women, I treat infants, I treat elderly, I treat children. I used to work in oncology for about 18 months after I graduated from school, and my little heart couldn't handle that. It was a little bit too much for me, but I loved working with oncology patients because specifically during radiation treatment, there's a lot of natural therapies that you can't use because it'll interfere with the effects of the treatment. And that's where homeopathy can shine, is because it's not going to interfere with the effectiveness of like radiation treatment or chemotherapy. So more on safety, non-toxic and very gentle. There's no risk of chemical toxicity, even if you were to ingest a whole vial of this substance. There are no drug interactions, safe to take along prescription medications. It's non-drowsy, even some of the remedies I'm going to talk about for stress. There's no side effects, and so it can't impair your alertness while you're on shift, which I think is really important. And a lot of the medications and natural substances that you can use for anxiety can have that dampening of your cognitive affect. It can just slow things down a bit. We don't want to have any of that. Safe for all ages, pregnancy, lactation. They're non-habit forming. There's no withdrawal symptoms, and we have at least 11 studies confirming minimal adverse effects from homeopathy. So then why do I want to present homeopathy to you guys? It's highly affordable. One of these vials on Amazon and in Sprouts is somewhere between $8 and $10. This can last you months of treatment for $8 to $10. There are no side effects, and I think I've mentioned it like 5 times, no interactions with conventional meds. Meaning I like to have the integrative approach. I am by no means, as you guys, if you've heard me speak before, anti-conventional medicine in the slightest. Conventional medicine saves lives every day. I think it's an amazing form of medicine. I just think there are some holes and gaps that I think natural medicine fills really well. Okay, so for specifically first responders, there's a lot of physical recovery that can be gained from using these medicines, helps with injuries. There's a lot of injuries in first responders, particularly in our fire department, as I see with my husband, shoulders and backs. They are just like kaput after about 20 years in service. Sprains and bruises and muscle strains. They're helpful for stress. I'll talk a little bit more about stress and how to be safe about approaching using homeopathic medicines for your emotional health, but it can be helpful for emotional shock and grief and even mental fatigue, especially after some of your more difficult calls. Safe and non-addictive, empowering self-care. I love that this might be a tool that you can use to help your own health and something that you can reach for, that doesn't necessarily require you to step outside yourself to be able to care for your own self. I think that made sense. And okay, look, it works alongside conventional medical treatment. Didn't realize I put that in there so much. Okay, how to use it. So the easiest way is you just take 2 pellets. The instructions usually say like 5 pellets 3 times a day, but you really only need 2 pellets. Under the tongue, and you allow it to dissolve. They are lactose pellets, and so they're coated in the medicine, and then it dissolves under the tongue, and under the tongue is just the quickest way to absorb it into the bloodstream. If you have little kiddos, or if you're using it with animals, they can just chew them up, and that's no problem. You're going to dose more frequently for acute conditions, and you're going to dose less frequently for chronic conditions. And I'll give you some more information about that as we go on. Okay. Oh yes, so for acute conditions, when I'm saying acute conditions, what I'm talking about is a recent illness, a recent injury, or a recent shock or perhaps trauma. I'm not talking about the years of overstrain or overuse, or perhaps an ongoing mental emotional health condition. Acute situations are something that just happened. I just sprained my ankle, or I just strained my low back. I just got a cough or cold. You can dose about every 15 minutes for up to 1 hour. If you're not feeling improvement in those first 4 doses, not the right remedy, pitch it aside. If it is the right medicine, you'll start to feel improvement. And then as long as you're improving, you don't need to take another dose. And as soon as you kind of feel a little bit of that relapse, you dose as needed. And that will just help speed the body along towards healing. For chronic conditions, a very easy way to dose is just once a day. Say you've had low back pain for 20 years and you're interested in trying homeopathy, it would not be uncommon to start once daily. And then again, as the condition improves, you can slow down the dosing and take only as needed. And a dose again is 2 tablets under the tongue or 2 pellets under the tongue. All right, let's get into our actual medicines now. Arnica montana. I'm sure most of you have heard of arnica. I'm just curious if you have. If you have, put a little note into the chat. What I love about arnica is there are many studies showing its effect in post-operative care, reducing swelling, reducing pain, reducing the need for pain meds. And a lot of surgeons here in the Phoenix Valley are actually prescribing arnica on their treatment plans to the patients. My husband had shoulder surgery almost 15 months ago, and one of the things that he was recommended was arnica in the recovery. I just think it's so fantastic. And to be honest, I'm sure these surgeons don't even necessarily know that it's homeopathy or could describe much about it, but they're embracing it because it's effective. So arnica is one of our most widely used homeopathic medicines. Any sort of blunt trauma, bruises, bumps, falls, my first go-to is arnica. And what we see is it can speed the healing, reduce swelling, reduce the bruising. Arnica can also be helpful for overexertion training and intense muscle soreness. As I mentioned, post-operative and also with dental work, less pain, recovers faster. I have a protocol that I use with all of my patients for when they're going into surgery and how to use arnica. And I've had a number of patients that they don't necessarily, depending on the surgery, need any of their pain meds because the arnica works so well for them, which is just a huge win in my book. So it's interesting. One of the ways in which you can identify arnica in one of our more severe physical traumas, that patient's like, I'm fine, don't touch me, like everything is okay. You might instantly think of arnica in that moment. It's a very common response to trauma that arnica can be helpful with. I've had a patient and a good friend both suffer a concussion in like the last 3 weeks, and they both started treatment with arnica. As their symptoms evolved and changed, my girlfriend developed an incredible amount of nausea, which was really interesting. We switched her homeopathic medicine from arnica to a different one. And same with my patient, he started developing some different symptoms. So we used arnica initially, and then as the symptoms changed, we individualized based on their concussion symptoms. The next one, Rus toxicodendron, one of my most favorite homeopathic medicines. When I think of Rus tox, I think of like arthritis and joint pain. So the type of pain of Rus tox is usually accompanied by great stiffness. It's, you wake up out of bed and you're like, oh God, I feel like I'm 80 years old. And those first few steps are like death. And as you move and as you kind of warm up, the body starts to feel a lot better. That's your very typical Rus tox picture. It's like that rusty gate, right? You open up the gate, it's like, and you start moving it more and more, and then it gets better. Rus tox is more indicated, well, arnica for that initial acute phase of like blunt trauma. Rus tox is kind of the follow-up to that. It's like, I sprained my ankle, I took arnica to reduce the swelling and the bruising, and now I'm dealing with like the after effects of the sprain or the strain. That's when Rus tox will really come into play. So remember, it's like that pain accompanied by stiffness worse on the first motion, better after moving. With the rest talks picture, they can go a little bit too far, and like too much exertion doesn't feel good, but it's that, that initial, oh Lord, and then I keep moving and then walk on, and that's your rest talks picture. Repetitive motions, injuries from repetitive motions, lifting heavy gear, rest talks can be very helpful for that. Find that rest talks is often indicated when there's cold, damp weather. So as soon as a storm is rolling through, I know all of my rest talks patients, whether it's with their migraine headaches or with their arthritis or their fibromyalgia, they're all going to be dosing more frequently their rest talks. And often the pain and stiffness with rest is better with like warm bathing and stretching. Okay, hypericum. Hypericum perforatum is the arnica of the nerves. So this is for like any nerve pain. And we know that it's nerve pain when it's more like sharp and shooting and electrical like. That's nerve pain as opposed to like the aching or the throbbing or the pulsating that arnica might be helpful for. We see this in the crush injuries, finger, toes, tailbones, severe nerve pain. Whenever I think of hypericum, I remember I went to a wedding. It was one of my brother's best friends, and another good friend was the photographer. And she was sitting there and she was trying to take her photographs, and she had this horrific neck pain. And I asked her about it, and she's like, it's like electrical, and it's like a 12 out of 10. And she was trying her best to like take the photos of her friend's wedding. And I went and I got hypericum, gave her a dose, and came back in 15 minutes. She's like, what did you give me? That has worked better than any of the ibuprofen I had ever taken. And I love it when homeopathy works like that. It's just so gratifying to give somebody relief in the moment like that. Let's see, what else did I say? Post-surgical nerve pain. So again, post-surgery, if it's like swelling and aching and throbbing, arnica. If it's post-surgical nerve frame pain and they actually didn't get all that root canal and it's like electrical shooting, very bad pain, I would reach for hypericum. So to use an injury, medicines are usually taken in a 30C potency. That's what's most common is these blue vials. There are other strengths. Purple vials are 200 potency. But most commonly what you'll pick up in the stores is a 30 potency. And you can start that every 15 minutes for an hour, and then every 2 to 4 hours, usually in those first few days, up to like 3 days. Surprise, surprise, it works alongside conventional care of splints and surgeries and conventional meds. Like I said, it's great if you don't have to take as much of your oxy after your surgery if you don't have to, by using these very natural pellets. And then once you get improvement and the improvement is steady, you can stop. If you have any sort of relapse or worsening, you can start again. Just kind of modify your dose with how you're doing. Illnesses. Okay, super simple. What I love about what I'm going to share with you now, cold calm, allergy calm, oscillococcinum, these are combination remedies. So what some of these manufacturers of homeopathy did is, instead of you having to be like, okay, I have a cough, which of the cough remedies do I need? And there's like 35 different cough remedies. They put the most common remedies into one homeopathic medicine for you. And I found it's really interesting because being trained as a homeopath, a naturopath, and a homeopath, in the beginning years of my daughter's life, I was like, I have to find the right exact medicine. And then I came across these combo products. And it really, really simplified things for me, even as a homeopath, to give her just the one medicine and not have to find that quote unquote right medicine that she needed. And so I use these all the time with my daughter. And as contrast, she does really, really well. I've been able to abort many coughs and many sicknesses by starting these early enough. So homeopathy is going to be most effective if we start this as early as the symptoms come on, right? You get that feeling. You're like, oh, I feel like I'm coming down with something. I'm a little achy. I'm a little bit tired. Take a dose of this. Couple hours later, take another dose, go to bed, wake up in the morning, and let's see what happens. So this one, Cold Calm, comes in the tablets, comes also in the pellets. It works best for cold symptoms, sneezing, runny nose, nasal congestion, stuffy nose, sore throat, sinus discomfort, headaches, blah, blah, blah. General feeling of coming down with something. I love Cold Calm. I think it's really great. And again, super safe, super gentle. I just love it. The next one is more for flu. So this is oscillococcinum. Oscillococcinum is the most popular medicine from this brand. A lot of what I'm showing you is from a company called Boiron. And Boiron is the world's leading manufacturer of homeopathic medicines. They're located in France. I was lucky enough to be invited out by Boiron a couple of years ago to view their facility, and I totally nerded out watching how they make these remedies. I thought it was just the coolest thing. But oscillococcinum is really great for flu symptoms. And they have a number of studies. I think there's like 5 or 6 studies that show efficacy of reducing duration and symptoms associated with flu. And it's just this little packet. It says you have to take the whole thing. I find you can just take half, you can take a third. The amount of pellets really doesn't make a difference. With ibuprofen, if you want more of an effect, you take more tablets of ibuprofen. With homeopathy, if you want more of an effect, you take it more frequently rather than more of the amount. Um, so they show efficacy for children over the age 2. I also found out, and I didn't put this on the slide because it's kind of like off label, but this can be really helpful at preventing flu. So my family, during cold and flu season, we take a dose of oscillococcinum about once a week, and knock on wood, none of us have had like severe flu, like influenza A or B in the years that we have been doing this. And I've had influenza A and it's horrific. The actual flu is so uncomfortable. Okay, allergy calm. I threw in allergy calm because here in Arizona, we get lots of allergies. We get lots of springtime allergies. We get lots of fall allergies. And in the summer, we don't open any of our windows indoors. So we have lots of indoor allergies. So it's like all year round. And allergy calm is just a really fantastic combination product that has all the great, what is there? 1, 2, 3, 4, 5, 6, 7, 8 homeopathic medicines included in allergy calm, and it works really phenomenally. I will be honest, when my patients with allergies, I usually have them reach for allergy calm, and then I have them take a natural antihistamine. D-Hist by Orthomolecular is just phenomenal. And most of my patients, I can take them off of like a conventional allergy meds and antihistamines. So this is kind of opposed or in contrast to the cold calm. It's more of the itchy, the watery eyes, the sneezing. Sometimes it's hard to differentiate a cold from allergies, but you can try these as they won't interfere with each other, and it'll be easy peasy. So tips for using with illness, again, as soon as you notice the symptoms, if you can start dosing, that's the best bet. You can even abort your illness entirely if you start early enough. They have dosing instructions on the package. I just say follow the package. It makes it so easy. And then again, as you improve, you don't need to take it as often. One thing with illness, especially with like sore throats and making sure that it's not like a strep infection, strep throat or something like that, is if you're not improving in a couple of days, go see a provider, particularly with that throat. Same thing with a cough. If you're not improving by the medicines in a couple of days, then you might need something a little stronger to take care of that. Okay, my friends, stress. So I just wanted to input a slide in here first about being smart with your emotional health. First of all, and I'm sure that this message has been relayed over and over through this conference, which is one of the reasons I love the work that Dr. Dara does, is the way that you are feeling, you are not alone. You are not crazy. There is nothing wrong with you if you feel a certain way in your emotional health. And that help is just a phone call away. I think most of you guys know that Dr. Dara is like a 24/7 open. Maybe I shouldn't promote you like that, Dr. Dara, but there are people who are always available for your needs, and it's just a simple phone call away. Um, if you are interested in using homeopathy for your emotional health, I encourage you to reach out to somebody who knows what they're doing. Treating yourself for a chronic condition like anxiety or PTSD or depression is really challenging. And so if you're interested in like treating yourself for like a chronic mental health disease, I encourage you to work with like a trained professional homeopath. And I have one colleague, she's specializes specifically in bipolar disorder. That's all she really sees is bipolar disorder, and she uses homeopathy really, really successfully. I work with a lot of patients. All my patients have some degree of anxiety and depression, mild and moderate, sometimes occasionally more severe. And so I've done a lot of work with patients in their emotional health using these medicines. And then lastly, I just want to say, as I'm teaching you these medicines to use, and I'm only going to teach you four, and there's so many more, don't use homeopathy as an excuse to delay or avoid effective medical treatment. I find that the patients, when I'm working with anxiety or depression, work best when they're working with a counselor, and not always with pharmaceuticals. That isn't necessarily for my patient population necessary, but counseling I find really complements homeopathic treatment very well. And then just there's so many of us that care about you guys. And so you're not alone. Help is only a phone call away. Just be safe with your emotional self. Okay, the first homeopathic medicine I want to mention is aconite, Aconitum napellus. This is a different company. And aconite is indicated both for a sudden shock response and a sudden illness response. And so most often with aconite, there's been an exposure to some type of trauma. And then as a result of that, the patient becomes overwhelmed with fear, usually intense, sudden onset fear, or like panic attacks, right? When you think of the quintessential panic attack, particularly when the patient is very restless, they're very fearful, they're like, oh my God, I'm going to die. Aconite can be really helpful to lower the degree of intensity for those panic attacks. Um, Again, I feel like I just want to re-emphasize myself over and over. If you're having panic disorder or you're having panic attacks, you should seek care through your psychologist, through medication, but homeopathy can also be really complementary there. So the same thing that we see with a sudden onset of like fear, we can also see in the sudden onset of illness. So aconite is often used for, like, I think of kiddos who wake up in the middle of the night screaming in pain with their ear infections, right? And so they wake up and they're like restless, and a lot of times the children can be like freaked out. That's another great indication for aconite. It's like the symptoms come on fast, they come on strong and sudden, and there's often a lot of fear associated with it. So aconite can be great for that. Oh, Nux vomica. I love Nux vomica. My students love Nux vomica. Nux vomica is indicated for the overworked, the overstressed, and the very irritable person as a result. Nux vomica is often indicated when there's like irregularity in diet, irregularity in sleep, too much drive, too much go, 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 not enough rest. We often see digestive upset with Nux vomica, lots of heartburn, lots of nausea, lots of constipation, or even conversely diarrhea. And those usually come from being overworked, from too much junk food, from too much caffeine. You get into a Nux vomica state. My students love when I teach them that Nux vomica is great for hangovers. Like if you think of like that headachy, nauseous, oh my gosh, it's too bright, it's too loud, it's too don't touch me. Like that's a great like snippet of what Nux vomica is indicated for. I also find that Nux vomica is often very indicated in difficulty sleeping, particularly when the patient wakes around 3 to 4 a.m. They have the racing thoughts. They're often thinking about work or what they need to take care of or what needs to be done right in that 3 to 4 a.m. time frame. Nux vomica can be really indicated for that. It's also that type A personality, so tense, irritable, overdriven. They like can't shut it off. They have trouble relaxing. This is great in overall for our overworked, overcaffeinated, overstressed first responders with digestive or sleep issues. Nux vomica, one of my favorites. Ignatia. So we covered fear, we covered irritability, and now this is a fantastic remedy for grief. Um, it's the trauma or the shock occurs, and instead of becoming like fearful or frightened or panicky, you become very emotional and like overwhelmed with grief. One of the things that I want to say is, and often with my patients when I'm talking about grief, is for me, I love to have people have healthy expressions of grief. Cry, weep, wail, allow it to come out. It's not a problem when you have a loss and you've lost somebody that you love, that you express this grief. And so that's not what I'm intending by saying this medicine is indicated for grief. It's like fast forward 4 to 6 weeks later, 3 to 4 months later, and you're still overwhelmed with the grief, and you need to like work, and you need to function, and you need to be like, back in your life, and you're still overwhelmed by grief. This is where Ignatia can be really, really helpful in the moment, right? To help calm that nervous system gently. Another way in which we might see Ignatia present itself is like lots of sighing, lots of like, oh, and like lump in the throat, or even like that desire to cry and the desire to weep, but it never actually comes out. They have difficulty crying, and there's like frustration, and the tears kind of get stuck, and then the headache, and then the chest ache. Ignatia can be really helpful at like relaxing all of that and allowing the weeping to come forth. Another indicator is like the mood swings, right? I see this so often in my patients when we touch upon grief. People get so uncomfortable, like they'll start joking in the middle of like their tears, and they're crying, and they're laughing, and laughing and crying at the same time. And then they're irritable and angry, and then they're crying again, and then they're happy. And so this like emotional roller coaster can be again calmed by Ignatia. We often see sleeplessness from grief or worry. The headaches of Ignatia can be intense, often one-sided, precipitated by grief or emotion. And similar to Nux, they can have a lot of environmental sensitivity. So sensitivity to noises and smells, and too much going on in their periphery. So Ignatia is probably one of my other top remedies that I love, love, love to help on the emotional level. Now, the last one, I'm sure none of us here have ever experienced any emotional, physical, or mental burnout on the job. I taught homeopathy to medical students, and it's right around midway through their third year that the burnout hits, and hits strong. Doesn't hit everybody, but when it does, I mean, these students like, I could give an F about my grades. I don't even care about this, and I'm having trouble caring for my patients. That's when it can become a problem. So phosphoric acid is indicated for that burnt out feeling. And it's just the exhaustion that comes from prolonged stress or grief, right? And you get to this stage of not caring anymore. You're apathetic, you're indifferent, you're no longer enthusiastic and like giving a damn. You can have trouble focusing, lots of brain fog. Sometimes diarrhea is accompanied by the exhausted state. Also very helpful for like caregivers. I've used phosphoric acid for those caring, and just the stress of the worry and the caring for other people, and they leave you completely depleted and exhausted. Phosphoric acid is really helpful at starting to perk back a little bit of life into the system and into the nervous system. So when I think of phosphoric acid in terms of first responders, it's the depleted first responder, mentally foggy, emotionally flat, tired, particularly after prolonged stress, prolonged strain. So there are also many combo products for stress. And again, I introduced you to 4 medicines that can be helpful for the emotional case. There's also ones where they put, a bunch of indicated remedies into one product. So Stress Calm by Boiron, Nerve Tonic by Highlands. I know I highlighted Boiron a lot. In one of my next few slides, I'll show you some other homeopathic companies that also produce great products, but they are by far, I think, so reputable and easy to attain, and ever present across the world. But yeah, so I would have you follow these. I actually don't have either of those with me right now. I would have you follow the indications on the packaging, and it's usually just for the occasional stress or the occasional day where things might be a little bit too much. Remember, homeopathy is not a substitute for seeking help that you need, and consider consulting with a professional homeopath to get that individualization, because not everybody with grief needs Ignatia. There's Natrum muriaticum, there's Staph aureus, there's Pulsatilla, and they all present so differently in their grief state. Same with fear. Aconite is not the only medicine for panic attacks. And irritability and anger, don't get me started. There's so many homeopathic medicines indicated for irritability and anger. So if you're interested in working with yourself on an emotional level in a chronic case, I suggest just seeing a homeopath. And if you're like, hey, is there a homeopath in my area? I'd be happy to look at some names for you and give you some recommendations. And I'd also be happy to work with you too. And then, so I give a little bit longer for the emotional piece. If things aren't improving in a couple of weeks, because sometimes the emotional body, it doesn't shift so like readily in a matter of hours, like for illnesses and injuries. So if you're not improving in like a week or so, then I would say we need to find something else to support you. Practical tips. The packaging always directs us great on how to use it. It's safe to take with your conventional meds. So even patients who are on antidepressants, I work with a lot of patients, particularly since COVID, a lot of patients on SSRIs, SNRIs, benzos. Homeopathy does not interact with those. There's no interactions there. We're like, you're not safe to take St. John's wort, which is a very commonly recommended herb for depression that is not safe to take alongside antidepressants. So, side note, homeopathy doesn't have those interactions. Seek professional care and store your remedies in a cool, dry place. Closet works for me. Putting it into practice. So perhaps maybe, especially for injuries, maybe you want to throw a little vial of arnica in your bag, or maybe you want to put a couple other remedies in there. This is my travel kit. It's way more comprehensive. I am a homeopath, so I can't help myself. And take the combo products. They're fantastic and really easy to use while on shift. How you do this is you just observe your symptoms for a minute, and then you match your symptoms to your complaints. And I'll show you a tool that's on the next slide. I'll show you a tool that you can use to try to help identify the right homeopathic medicine. Keep in mind, you don't have to have a perfect fit. You want to get a close enough-a-cum. They have all these strange Latin names. And so I always tell my students, we want the close enough-a-cum. It doesn't have to be that perfect remedy. And you just take one dose under the tongue, watch for a couple of hours, take a second dose. If you're feeling like it's helping, that's great, continue. If you feel like it's not helping, maybe you try another medicine or you try something different. I'm going to show you, if I have enough time, yep, I'm going to show you the National Center for Homeopathy, homeopathycenter.org, their website. They have this free tool to help you find a homeopathic remedy if you want to try it. They have a lot more information. Boy Ron has a ton of information. If you wanted to try some more homeopathy for yourself, for coughs and colds and allergies and UTIs, and I mean, it's used for every which way, 158 medical conditions published in peer-reviewed journals. This book, Everybody's Guide to Homeopathic Medicines by Stephen Cummings and Dana Ullman. Dana Ullman is a kick. I've met him at many conferences. He's a riot. This is a really great book. It shows you not only what to do for home care, but red flags when you need to go see a doctor, when you need to go like to the ED if it's not safe, and then which remedies are most commonly indicated. The other homeopathic companies, Highlands, Genexa, Hahnemann Labs, Oleos, all of those are fantastic companies, but I do think Boiron has the widest reach of them all. I'm going to hop real quickly into the National Center for Homeopathy. This is their homepage. Click on the Homeopathy Learning Center and then scroll down to the Find a Remedy tool. And it'll take just a minute. Here we go. And then I'm going to scroll down, see they have everything from acne and allergies. Homeopathy is great for animals. They have lots of studies. They have homeopathy research studies on how it affects plants and the plant resistance to pests. It's amazing. This gentleman in Argentina doing work on strawberries and homeopathy. Okay, let's go to ankle sprain. So we'll just click on the most common remedies and it'll show you the names of the most common remedies. There's rust toxicodendron, sprains with stiffness, restlessness, aching, worse when first moving, better for a while with continued motion. So they have here, if you wanted to try homeopathy, you can go on here and read the different types of presentations for ankle sprain, find the one that most closely matches your symptoms and give it a shot. They have all sorts of different conditions here, but this is just a really easy find a remedy tool. I will say I dabbled with AI when AI came out. It's not too far off if you're able to input your symptoms. Not always, though, but I have seen that AI knows homeopathy, and my AI likes homeopathy. I'm sure other people's AI might say different things. Yeah, so I just wanted to show you guys that. And then let me see. Questions. Thank you for your service. Here's my email. If you have any questions for me, I'm happy to chat with you about it. I hope you enjoyed learning about homeopathy. It's just something a little bit different. So, yeah, thanks.
Thank you so much, Dr. Rice. That's awesome. I was telling Tava as you were talking about it, I said a lot of this stuff is like way over my head. It's like so much, like so many new words that I don't even know, you know?
It is
Uh,
different. I often talk
but
to my students like it's like acupuncture. It only took acupuncture, what, 2,000 years to enter mainstream conventional medicine. So I'm like 1,800 years away from being accepted.
Well, I feel, I mean, the great part is I feel like it's more and more spoken
Yeah,
about and more accepted because of people like yourself and other
right.
pioneers who keep pushing it, to at least have conversations like this, so that way they're not foreign words anymore. At least
Yes,
people can say, "Oh, I've heard about that before,"
that's exactly
and then
right.
they could have conversations with their doctors about it, which is good.
Hmm.
And so. I know that you utilize these things. I know that we have these in our house. I've seen some people here online that say that they utilize that. I think Luz also said that she raised her kids on it, and now they give
Fantastic.
their kids their remedies and
Oh,
stuff. So that's pretty
love
cool.
that.
Yeah, that's
Yes.
really cool.
Yeah.
So this is intimidating, I think, for people. I think that one of the most common things that people talk about when they first come and present to get help is sleep
Hmm.
issues. I just
Hmm.
had somebody here too, and I want to talk to
Hmm.
you about somebody tonight as well, about grief and sleep. Uh,
Hmm.
but I know that you have other questions in here, so I don't know if you want to get into that a little bit and then maybe read some of the questions and talk about some of that stuff too.
Sure, absolutely. I mean, I think based on the job, what I find, especially for like first responders, is like they are so trained to be on the go, right? Like they are ready to respond. Their adrenals fire off a bit of cortisol, get some adrenaline going, and they're like, go, 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 go. And what their body is not accustomed to doing, slowing down, calming down. We go from the sympathetic nervous system, the fight or flight. We can't get into the parasympathetic nervous system. Some people don't tap into that through their whole night's sleep. They're grinding their teeth. They're having like the crazy dreams. They're like all these sorts of things. Our bodies don't know how to shut down. So this is not homeopathy, but one of the things that I might recommend is starting to learn how to do deep breathing techniques to start dabbling in forms of meditation that work and are not like perhaps even traumatizing, but you basically teaching the body how to get into a relaxed state because it doesn't know how to do it anymore. There's tons of homeopathic medicines that can be, and herbs too, that can be helpful for sleep. There's Sleep Calm by Boiron, Nux Vomica, like I mentioned, even Ignatia, if it's a lot of grief associated with the sleep. But if it's a chronic long-term thing, I think we have to train the body how to get into parasympathetic state. And most of us, you can recognize that state after your Thanksgiving dinner, right? When you overindulge in the tryptophan from the turkey and you're like so full and you're like, ugh. Or after an orgasm is another example of the parasympathetic state. And though we don't get there very often. And so I don't know if that's exactly what you're looking for. I wish I was like, oh, yes,
Yeah,
take
no,
this
no,
magic
no, it
pill.
is.
It will
It
help
is.
everybody.
And but I think that it begs the question of talk to a medical professional like yourself so that way at least you could do an overall picture. And I
Hmm.
think one of the things too that people don't realize is that when they go to see a naturopathic physician, these initial visits could take hours to do because you do a complete history and not just a
Yeah,
25-minute visit to say
yeah.
what's the problem, okay, let's just take this and get out my office. It's a very different approach.
Exactly. It's like understanding the root cause of why you are not sleeping as opposed to your neighbor not sleeping or your partner not sleeping, because it could be different. And I
Yeah.
find like conventional medicines can just be so overpowering. They just like overpower the body, whereas we want to like work with the body and restore balance and homeostasis to promote healthy, normal functions. I mean, you can get me started on like environments and blue screens and lack of exposure to nature and all of these things that dysregulate our nervous system and our bodies.
I've been seeing a lot more stuff too on grounding with people talking
Hmm.
about grounding sheets and grounding blankets and stuff.
Yep.
If they're not getting enough time outside, at least while they sleep, they could have access to things like that. Yeah.
Yep, and just be careful you're not getting scammed by some of those products. But I went out the other day when my mother-in-law was here and she was on her little iPad, but she had her feet on the ground because she learned about grounding. I thought that was so wonderful. I was like, well, maybe we got rid of the screen for 5 minutes. It would like further improve that. But I was so proud of her
Oh.
uh, for oh, sorry, somebody wanted to come say hi.
Hi, darling.
This is my reason for doing the medicine I do.
That's sweet. We get to
Mhm.
see you later.
Yeah,
Um,
I
so question for you. How would you help with hormonal balance, anxiety, and sleep? And then if you had multiple of these remedies, is it safe to take them together?
Yeah, it's not as effective. Like the one right medicine for you is the most effective, but you can take them together. Just often it doesn't work as strongly that way. That's why the combo products, when my patients are taking combo products, if I can find that one medicine that they need, it usually is so much more effective than the combo products. But yeah, it's hormonal issues. That's mostly what I work with because most of my patients have ovaries and uteruses, and so I'm constantly working with hormones, and homeopathy can be very helpful at reestablishing balance there too.
Yeah, I feel like the conversation in the last 10 to 12 years, maybe for a lot of guys, is now this testosterone replacement stuff.
Tea.
And so a lot
Yeah.
of folks are really, hearing this low T, and so
Uh-huh.
they're taking these shots and stuff, which eventually they end up getting off of because it's messing them up.
I know. I will tell you, everybody that starts testosterone will feel like $1 million. When we restore our hormones levels to where we were in our 20s, you're going to feel like $1 million, but it doesn't last. And then the
Hmm.
side effects can be really, really intense, usually for those,
Yeah.
for people on long-term hormone replacement. I'm not anti again, but
Hmm.
it's about matching the needs of the body and not overdoing it, in
Yeah.
my
And
opinion.
and realizing that we're gonna age. You can't be at 20 when you're 55.
Yes. Oh,
And
it's
it's
so different.
okay. Yeah.
Yes. Yes.
It's yeah. Uh
Andropause, menopause. Yep.
Kerwin is based in St. Vincent and the Grenadines, and so I'm not sure if they have these
Interesting.
remedies over the counter. Or
Sure.
yes, they can be. Yes, even in you think in the Caribbean, maybe hopefully they'll be able to find that over the counter.
That's a really good question. I know in like Mexico and I know in Canada and Australia, but yeah, in the Caribbean, I mean, that's how long it's been since I've been down there. I need to plan a trip.
Well, Kerwin, there you go. We need to come to St. Vincent and Grenadines to explore.
I think it sounds great.